I'd like to start by introducing myself. My name is Josie Traub-Jargitz. I'm a professor of equine medicine at Colorado State University in the College of Veterinary Medicine and Biomedical Sciences. And I serve as the equine commodity specialist for USDA, APHIS, VS, SIA through a cooperative agreement between CSU and SIA. I'm going to provide an overview of the NAHMS equine studies with an emphasis on the upcoming NAHMS Equine 2015 study. There's a team of people who have been involved in design and planning for the implementation of the NAHMS Equine 2015 study, and they're listed on this slide. Their roles vary and include veterinary medical officers, statisticians, field liaison, technical editors, ag economists, OMB liaison, and others. The USDA APHIS Veterinary Services Center for Epidemiology and Animal Health, that I'll abbreviate throughout the presentation as SIA, is a unit within USDA APHIS VS and is located in Fort Collins, Colorado. The NAHMS program is a part of SIA activities. The purpose of the National Animal Health Monitoring Systems, abbreviated NAHMS, the program is to collect and analyze animal health data to provide information on livestock population, diseases, risk factors, health, and biosecurity practices of U.S. livestock industry. The NAHMS Equine 2015 study will be the third NAHMS study of the equine industry. Previous NAHMS equine studies were done in 1998 and 2005. Reports and info sheets generated from those previous studies are available on the NAHMS website. The URL for the website is listed on this slide. Once at the NAHMS site, select the equine section to view these materials. In order to best meet the needs of the livestock industry, veterinary practitioners, state animal health officials, and others within USDA APHIS VS, NAHMS performs a needs assessment to gather input related to the focus areas for the study to be conducted. The input from the needs assessment are used in development of the study objectives. A report has been generated based on the needs assessment conducted as part of the planning for the NAHMS Equine 2015 study. This report was posted to the NAHMS website in April of 2014. This slide shows the table of contents of the needs assessment report. The report is 21 pages long and includes a summary of the input received during several portions of the needs assessment. As part of the needs assessment, leadership among several industry groups was sought. These included the American Association of Equine Practitioners, abbreviated AAEP, the American Horse Council, the National Assembly of State Animal Health Officials, abbreviated NASAHO, members of APHIS VS Equine Group, leadership within the Coalition of State Horse Councils, and those participating in the National Equine Industry Monthly Calls. There was an opportunity for anyone affiliated with the equine industry to give input as part of the needs assessment through an online survey. The announcement about the option to provide feedback by completing the survey was distributed through equine media and industry groups. There were over 2,400 responses, with the majority being equine owners, as depicted in the royal blue in the figure on this slide. We also received input from those with a primary role of equine farm manager, practicing veterinarian, trainer, researcher, extension, event manager, farrier, and state veterinarian. Based on the needs assessment and priorities within USDA APHIS VS, 7 main objectives for the NAHMS Equine 2015 study were developed. They're listed on this slide. They include providing estimates of trends in equine care and health management, comparing results from the NAHMS 2015 study with those from 1998 and 2005 study, estimating the occurrence of owner-reported lameness and the management of those reported lamenesses, to describe the management of equine infectious diseases, describe selected equine health care costs, to evaluate gastrointestinal parasite control practices, to evaluate equine for ticks and describe tick control practices on equine operations, and collect blood from equine on selected operations along with demographic information to create a serum bank for future research. A key component of each NOM study is to keep the industry and others informed of the status and plan for this study. Thus far, multiple presentations have been made on the NOMS Equine 2015 study in order to keep stakeholders updated on the outcome of the needs assessment, the objectives for the study, and the timeline for implementation. The meetings at which presentations have been given thus far are listed on this slide. Groups that have received information as part of these presentations are diverse, including practicing veterinarians, state animal health officials, and equine industry groups represented within the American Horse Council and state horse councils. Another means by which we want to keep the equine industry and others informed of the study is providing a stakeholder announcement which provides key aspects about the upcoming study. A stakeholder announcement for Equine 2015 study was sent to equine media, American Horse Council, AAP, and equine extension groups. It was also sent to the APHIS stakeholder registry. This was done in March of 2015. The design of the NOMS equine study are based on objectives for each study. For Equine 2015, we got input from veterinary medical officers in each of the 6 VS districts in order to fine-tune the study design based on their field experience. Questionnaires that will be used in the NOMS Equine 2015 study were pre-tested at equine operations in each of the 6 VS districts by our points in contact. And NAS questionnaire was also pre-tested by NAS enumerators. Based on the pre-test findings, the questionnaires were revised and were re-pre-tested by NOMS personnel. All this effort is made in order to optimize the ease of interviewers in collecting survey data during this study. Phase 1 of the study, we also call the NAS component. Data will be collected via a face-to-face interview using a survey form entitled the General Equine Health and Management Questionnaire. NAS collection will begin in May and go through the end of July. Many questions on the Equine Health Management Questionnaire are a repeat of those used on the Equine 98 and 2005 NAS surveys. The use of similar questions allows for comparison of results and reporting of trends in equine health management over time. Objective 1 of the study is reporting these trends. NAS conducts training of enumerators in order to optimize response rates and consistency in collection of survey data. The training will include a background on the study objectives and design, areas in the questionnaire that may be more challenging, and information on how best to resolve challenges will be provided. In addition, there will be a manual provided to each enumerator that will include instructions on conducting the interview for Phase 1. Phase 2 is the VMO component of the study. Phase 2 consists of a second questionnaire that will be administered by a veterinary medical officer or animal health technician. Phase 2 will run from the beginning of August through the middle of December. In addition to administration of the Phase 2 questionnaire, the VMO or AHT will also collect biologic samples and perform assessments that will allow us to meet the study objectives. States for participation in the NOMS Equine 2015 study were selected based on the size of the state equine population or the density of the equine population. Selected operations will represent at least 70% of the equine operations and equids in the U.S. Operations with 5 or more equids on the NAS list frame were eligible for selection to participate in the study. The blue shaded states on this map are the 28 states included in the NOMS Equine 2015 study, and the participating states are listed in alphabetical order under the map. Now that I've provided an overview of the study, I want to go into a bit more detail about the study. There will be a total of 3,997 equine operations across the 28 states selected for participation in the study. In April 2015, a letter will be sent out to introduce the study, along with an equine information sheet to the selected participants. A NASS representative will be assigned to contact each of the selected equine operations to schedule a time to visit the operation in order to collect the survey data. This phase of the study will be from the beginning of May through July 2015. All equine operations that complete the Phase 1 questionnaire will be eligible to participate in Phase 2. The NASS representative will provide information about the Phase 2 participation and ask the equine operator to sign a consent form giving NASS permission to turn over their contact information to USDA APHIS Veterinary Services. On this slide, there's an example of the information about Phase 2 that will be provided to equine operations as part of the Phase 1 visit in order to encourage them to participate in the second phase of the study. We anticipate, based on our experience in previous NOMS equine studies, that approximately 3/4 of the operations selected by NASS will participate in Phase 1, and that 60% of those participating in Phase 1 will agree to be contacted by a veterinary medical officer regarding participation in the Phase 2 of the study. A federal veterinary medical officer has been assigned in each state to coordinate Phase 2 of the study. The coordinator will be the point of contact for the NOMS field liaison and will oversee implementation of the study in each state. VMOs and animal health technicians in each state will be doing the field work. They will go through training and be given a manual to assist them in completion of questionnaires and other aspects of the Phase 2 of the study. On this slide, there are some images that illustrate the training that VMOs and animal health technicians will receive via conference call, webinar, and AgLearn modules that have been created specifically for this study. There will be video and photos along with audio instruction as part of the training sessions. The Phase 2 questionnaire will be administered via a face-to-face interview at the equine operation. The person who knows the most about the management and health of the equine on the operation will be asked to respond to the survey questions. There are 6 sections to the Phase 2 questionnaire. The questions on this survey are designed to allow NOMS to collect, analyze, and report results that will meet the study objectives. The sections are an equine inventory, specific equine vaccine use section, parasite control practices, and owner-reported parasite problems in their equine section, owner-reported observation of ticks on equines and tick-associated disease and tick control practice sections, and an owner-reported occurrence of various types of lameness and management of those lamenesses section, and lastly, a section on equine healthcare costs. For equine operations that agree to have blood collected from equine on the operation, the VMO or animal health technician will collect blood from up to 20 equine with the number of equine sampled based on the total population on the operation. The blood will be shipped to the National Veterinary Services Lab in order to create a serum bank for future research. Up to 10 equine on each operation will be examined by the VMO or animal health technician for the presence of ticks. The location and approximate number of ticks will be recorded, and a representative sample of ticks will be collected for identification at the National Veterinary Services Lab. On this slide, you can see in the white circle a tick along the upper area of this horse's neck. The VMO or animal health technician will perform a biosecurity assessment of the operation and complete a checklist based on their observations. A report of the findings will be provided back to the participant. Operations that plan to deworm their equids between the VMO visit and the end of the year of 2015 will be eligible to collect feces on up to 6 equine pre- and post-deworming for testing for parasites. The owners will be provided with the results of the testing. Instructions on sample submission will be provided to the owners as part of the parasite testing. A fecal egg reduction testing will be done as part of this study in order to identify anthelmintic resistance at the operation level. On a subset of operations, feces from up to 20 equine will be collected. The feces will be cultured in order to identify Salmonella and/or non-type specific E. coli. The isolates will be tested for susceptibility to a panel of antibiotics. Results of positive Salmonella culture will be provided back to participants. The benefits to participation include being able to compare the management and equine health events on the operation that participates in the study with those of the national and regional estimates. In addition, participants will receive results of parasite testing at no cost. They'll also receive the tick exam and ID results and the biosecurity assessment at no cost. A number of others beyond those that participate in the study will benefit from the NOMS study. They include equine owners and operators, even if they did not participate in the study, researchers, educators, extension agents, industry groups, and the horses, donkeys, mules, ponies, and other equine in the U.S. On this slide, we list some of the benefits to universities. Researchers can focus their research efforts based on baseline information obtained as part of the NOMS study, and educators can use the results of the study as part of their lectures as they provide information to their students about the equine industry, equine health, and management. On this slide, we list the benefits to the industry. Industry can use information from the study to better understand where equine owners are obtaining equine health information and compare trends in health and management over time. It is very important that the selected equine owner and operator participate in the study and that they provide accurate responses to requested information, and the data collectors work to schedule visits to conduct the interviews at convenient times for the participants. Our team at NOMS is hoping for a great response rate. We plan to provide results of the NOMS Equine 2015 study to stakeholders through reports and info sheets that will be posted to the NOMS study area on our webpage. To view the reports and info sheets from previous NOMS equine studies, go to the NOMS website. On this slide, you can see the URL for the NOMS website, and once at the NOMS website, select the equine section.